it is never too late because it's never too late to get stronger. And also the idea that the body is really resilient. It responds when it has better information, when we have better tools to know how to connect with our body, and adding more strength into our system at any age is always going to be helpful, first and foremost.
Hi, I'm Peavy.
Hi, I'm Jamie, and welcome to Blank is a Mother podcast.
We are two toddler boy moms that have been best friends since college, and we are here to share our unique motherhood journeys through a comparative lens.
And we all say we're not supposed to compare, right? But clearly we know that's not realistic.
Because the first few years of motherhood shook our lives and friendship like no other experience has.
And by comparing and contrasting our journeys, we've discovered the strongest threads of sisterhood yet.
We don't have all the answers, and we sure have made some missteps.
So we invite you to follow along as we do our best to nurture our friendship while making 1,000 tiny mama decisions in an unfair world.
Hey, y'all, I'm Peavy.
Hi, I'm Jamie, and welcome to the Blank is a Mother podcast.
Today, we have our very first podcast guest, and she is truly, truly amazing. She shared so much knowledge with us, so we're so excited to be able to bring this information to all of our listeners. Today, we are talking about Kegels is a mother. We're having a special conversation with Dr. Christine Pieton. She is a physical therapist, specifically a pelvic floor therapist located in Santa Barbara, California. I won't do any spoilers for what she's going to share. I will say we had conversations before and after what we actually recorded that were just as inspiring and enlightening. And for me, one of the things we talk about at the end is how to improve our healthcare, full stop, but specifically for pregnant mothers who are about to give birth. And one thing that she mentioned was how all of our maternal care is very baby-centric. And so one of the things she recommends for society is to have a pelvic floor therapist on your team and to check in with them at each stage that you would check in with your baby's development, if you are pregnant or postpartum, so that they can also be taking care of mama, because, that's a theme we have through a lot of our discussions is that we don't put enough attention on our own health.
I didn't even know what my pelvic floor was for everybody. And I'm not afraid to admit that or ashamed to admit that, because I feel like most of us don't know what our pelvic floors are, how even to engage them, the role that they play, and the larger, what did she say, team of muscles, including our diaphragms and our spinal muscles and all of those things. So I think if you are unfamiliar with your pelvic floor, this is definitely an episode that you should listen to, because it really does play a large part in our health. So again, if you want to learn something new, or if you are familiar with the term but don't feel like you know enough about it, I think Dr. Chris is the person to break this down into digestible laywoman terms that make sense to all of us.
Yeah. And we all have pelvic floors, not just women, men, any gender. We have a pelvic floor as humans. And so anyone can get really important information from all that Dr. Chris shared with us today. And if you don't mind me putting you on the spot, Jay, we had a really interesting conversation at the end offline about the differences from the cultural differences about talking about this topic specifically. Can you summarize that for our audience? Because I feel like that was a really interesting tangent that we went on that we didn't really capture in the conversation with Dr. Chris, but in our greater conversation, it was really important.
Absolutely. I mentioned that, we also need to be mindful of cultural norms as it relates to this conversation, because I would venture to guess I am not alone as a Black woman in, a few things. Number one, I didn't even know what my pelvic floor is. And number two, recognizing that there's some cultural norms that make it taboo to even have conversations, especially public conversations, about sex and your pelvic area and your vagina and penises, all of those things. can be culturally taboo to talk about publicly. And so I think that it's important that we are using this platform to bring awareness to the importance of pelvic health and recognizing that culturally, this may be uncomfortable or considered to be abnormal to some cultures that don't necessarily speak openly about these topics, but we are creating space for both to be true and a safe space where we can learn more about our bodies in a way that doesn't feel like it's just being sexualized. There are a lot of other health related issues that are tied to our pelvic floor, and we need to look through that lens as well.
Yeah, absolutely. Thank you for summarizing that.
You're welcome.
So to the point that you just shared about having a platform to bring all of this to light, I thought it was also interesting that Dr. Chris shared with us offline that it's podcasts like this, it's communities like this, virtual social communities like this that are shedding more light on this topic and actually disseminating this information that's so important that we don't get through our normal healthcare. And so really, I hope that this episode and other podcast episodes and other resources about pelvic floor health are shared widely because it made me feel good that we decided to focus on this topic because she said without, it was like around 2020 with the pandemic when everything kind of went to social, that the mother community really perpetuated the sharing of this information. And so she does not credit the healthcare system at all, which is real, but she credits mothers and women and, people on platforms like this for sharing the information. And so I'm glad that we can be a part of that. And so I just encourage everyone to share this far and wide so we can keep that information chain going.
Yeah. Keep strengthening our bodies, all parts of our bodies, not just our biceps and quads and triceps, like she mentioned, but also our pelvic floor, which impacts a lot more than we have traditionally thought that it did.
Welcome and enjoy, Dr. Chris. We are so excited that you are joining us today, Dr. Chris, and you are our very first podcast guest. So we are honored that you are here to talk with us today about pelvic floor health, which I feel like is a pretty big and unknown topic to a lot of women, moms, people. So yes, thank you so much for being here. And can we just take a couple minutes here at the beginning for you to introduce yourself and tell us a little bit about yourself and how you started your practice and what you focus on?
Absolutely. First of all, thank you for asking me to be on and coming to have a conversation today. And honored to be the first guest in this conversation with you. I am a pelvic floor physical therapist. I started my practice in Santa Barbara back in 2015. And I first started my PT career in what I would call more of the sports and orthopedic umbrella specialty. I love sports, love movement. And so that was my jam, still is. And then I was also a running specialist at that time and still am. But my female runners were actually the ones that led me to pelvic health and actually completely turned my world upside down in the best way possible, in the sense of helping me to realize that my deeper calling was actually blending my sports and orthopedic knowledge and adding to my toolbox of pelvic health. Because they were runners that had babies that then came back around and said, why does my body not work the way that I'm used to after having had a baby? And my sports and orthopedic protocol to get them back to running was not solving the problem like it was supposed to. And so that led me to realize we have a bigger problem here. And I don't know why about half of my patients are responding well to the usual return to sport run protocol, and the other half are not. And that was a big discrepancy for me, going like, I know my people are doing their part outside of the clinic, so this should be lining up. And so that led me down a rabbit hole at that point, trying to figure out what the heck is going on. Realized I think this is a pelvic floor issue, and shoot, I don't have tools to know how to solve this problem because we're still not incorporating pelvic health information and knowledge in our baseline of physical therapy education. This is an advanced specialty after we graduate, which is a whole other soapbox of mine. Because every human has a pelvic floor, so why are we not talking about it? And I happened to have a continuing education course that was down in Los Angeles at the time that this was all happening. It was like 6 weeks from when I was doing this deep dive with trying to figure out, how do I solve this problem? And going to that course was still with the intention of, I'm going to go learn more so I can figure out how to kind of solve this problem, but like refer these patients to the person that they need to go to, because I don't know who to send them to. And then that led me to realize that, oh no, I need to learn this, because we don't have enough people clinically that know this knowledge, enough people to be able to support these types of cases. We didn't have enough pelvic floor PTs in Santa Barbara at the time either. So I decided, you know what, I'm going to figure this out and add this to my toolbox and get comfortable with the idea of being super uncomfortable talking to people about all of these really intimate details, let alone get comfortable with learning how to do an internal pelvic floor muscle assessment, and also unpack a lot of these things that most people might not even talk to anybody about, but are really important for our day-to-day life and our quality of life. Mm-hmm. Yes, during prenatal and postpartum, but like every human, because prenatal and postpartum conditions are not the only reason why we can have pelvic floor challenges, although that is a very typical time in someone's lifespan when they can pop up.
Mm-hmm.
Dr. Chris, can I take it back to the very beginning?
Yeah.
Because I am someone, like Pete mentioned at the very beginning, that, and this is crazy because I'm a whole grown woman, didn't realize that I had even a pelvic floor.
Yeah.
So can we break it down and like, what is a pelvic floor and why is it important? And what happens to it during pregnancy, birth, and postpartum?
You bet. First of all, thank you for asking that question and being honest that you don't feel clear on that part of your body, because let's be real, the majority of adults also don't have a lot of clarity around this, because none of us were really ever given a good introduction to it. And back to the point of me going to my first pelvic floor PT course, for context, I was 29 years old. I already had my medical license. I, as a PT, am the muscle expert in terms of the medical field. Okay. And I'm sitting there, they put up the slide of the muscles of your pelvic floor, and I am looking at that thing as if it's I've never seen it before.
Wow.
And I'm like, how am I at this point in my life also, right? And going, how do I not know this? And being like grateful, but also like really mad and embarrassed at the same time, like sitting in that course. So just for context, I hear you.
Thank you.
Your pelvic floor is this really amazing team of muscles that sits in the base of your pelvis, or our pelvises, right? Every human has one. And its jobs are the same. It serves as our ability to control bowel and bladder function. It is essential for sexual function. It is a birth channel for those of us that are able to do that. And then it is actually also one of the main players of our core team. So it is essential for our body to be able to move and load and move well. So it's really freaking important and does not get enough credit for all of the jobs that it is responsible for, and also how it is part of a larger team within our body. So when a lot of people think of the core team, they think of like their abdominal wall or their six-pack ab muscles. And that is just one piece of the larger team. When I'm talking about the core team, I'm referring to your pelvic floor, your abdominal wall, your spinal muscles, and then your diaphragm, which is the main breathing muscle that lives in the base of your rib cage. All four of those create this muscular canister of support for our torso. That is what enables our body to move and load and do life. Mm-hmm. And they are constantly in communication with each other in terms of how to adjust the amount of pressure that we need in that torso to feel stable and to be able to coordinate and move and lift and do all the things. And it's constantly in this like fluctuation and adjusting because it's a shock absorbing system. And the pelvic floor is working within that.
So I know Jamie asked you about pregnancy and childbirth and all that, but before you get there, since the three of us are all athletes, and I know we want to be physically active our whole lives, do pelvic floors work overtime if you're physically active? Like if you're running, jumping? Because I mean, what I did know from my very minimal pelvic floor knowledge was that, okay, I had a baby, so now I'm going to have a harder time like holding my pee when I run or, jump or sneeze. Like things are going to get all wiggly jiggly, not as tight and easy to control. But have our pelvic floors been working, I don't want to say harder, but just like more because we've been more physically active through our athletics?
So this is a good question. So I hear the connection of what you're mentioning, and working harder, it can, but I'm going to bring it back to the idea of like this whole team, right? So within that team, if one or more of any of those players on the team don't have adequate strength, flexibility, if there's an interruption in their coordination, then other players on that team are going to have to pick up the slack. And that's okay for a short amount of time. But if that becomes the long-term pattern, then eventually that system is going to hit a breaking point and we're going to get symptoms of some sort. Those symptoms can be, but not limited to, back pain, hip pain, leaking, etc. And what I talk to my patients about and what I like to use that information, I go, that's feedback. That's feedback that the core team needs some help somewhere. And we got to go figure out where is the leak in the system, pun intended.
Yeah.
But also to go like, just because the location of where we're having symptoms is occurring doesn't mean that that's necessarily where the real primary source of the problem is. That's just the part that's getting overloaded. So I still have to look at the whole team and go, what's everybody's baseline right now? Who needs more support first to try to clean up the communication in the system and then rebuild the strength through that whole team to get everybody back on the team together? Can the pelvic floor be one of those players that increases its workload? Sure. To, let's say, sub in for a diaphragm that's not moving well, for back muscles that maybe aren't moving well or able to load as much as we need, or an abdominal wall, right? So we can have a pelvic floor that might increase in tightness because it doesn't feel like it has the support in one of those other players. That can be an overworking example.
Mm-hmm.
We can also have a pelvic floor that's not able to respond as well. So we're going to get increased tightness or overworking in one or more of those other players I mentioned. So it can go a bunch of different directions. Where we often see or people become more aware of this, challenge is the easiest place for a overload of this situation is through the pelvic floor. Because if you think about gravity acting on the system downward, and then if we think about that muscular canister again, so we've got the diaphragm that is like this umbrella muscle, if you will, that's like attached to the spine and completely inflates throughout the lower base of the rib cage. You've got the abdominal wall and then the spine with the spinal muscles. There's no place that's easy amongst those three players to release pressure if there's too much in the torso. So the easiest place is down. So that means that the pelvic floor then can very easily be overloaded. And so what's her option? To try to contract to counteract that, or it might be too much, or she might have been doing that for a while and now she's really tired and she can only let go. And then we get pain or leak.
Okay. Is a complete failure of the pelvic floor a prolapse?
Those are two separate questions.
Okay.
But I see where you're going and you're not wrong. Yeah.
Okay.
But yes, basically the idea of the pelvic floor, her job is to be a suspension system and a support system also for the internal organs that are sitting above her. So if she's constantly being overloaded or doesn't have enough strength to support the loading that's happening above her, or a challenge in terms of communication of when she is supposed to respond based on those other players too, we're going to have a challenge. And one of those challenges can be prolapse, meaning that those internal organs are constantly being pushed down and don't have a good support system underneath to be holding and countering that.
Well, I'd love the sports metaphors. Can I just say this? I mean, I'm a visual learner, so the sports
Yeah.
metaphors you're speaking our love language. So thank you for putting this into terms that are digestible and that we can visualize, because this is a newer term for so many of us. So along that thought process, Dr. Chris, now I may mispronounce this, and I may have been mispronouncing this for 42 and a half years, so please correct me. Should women, we hear a lot about Kegels. Do you say Kegels or Kegels? Peavy and I were saying this.
It's like tomato. Like some people pronounce them Kegel, either way.
I like your style. I'm going with Kegels because that's what I know.
There you go. Or pelvic floor contraction is the other like mouthful if you want to go there. But yeah.
I will feel fancier saying that. So should women be doing pelvic floor contractions? And we know that men have pelvic floors as well. We know Peavy's husband, actually, and I'm sure he said it's fine to share this. Peavy told me that he's gotten into Kegels himself. So is this something that, we should continue to do? Do you see the value in Kegels? And can you speak more to what that is in case people don't know what a Kegel is?
Absolutely. So here, let's kind of define sort of a Kegel in this case. So the way I define a Kegel is the pelvic floor contracting and also lengthening. So both of those phases are important for any muscle. So think about like your bicep, right? We want to be able to contract it, but we also need to be able to lengthen it for it to be functional for all the things we need to do. There's a couple of challenges in terms of how the general public, again, is educated, said in air quotes here, educated about their pelvic floor, and then told to basically do Kegels for any pelvic floor symptom. It's not a one size fits all. And also based on what I kind of previously shared, there's this whole team. So it's more sophisticated than just telling people to like squeeze a bunch to solve a problem. Okay. I also want to preface, I'm not necessarily anti-Kegel, but I go, there are better ways to strengthen our pelvic floor. Because I come from the thought process of when I'm helping somebody to strengthen a part of their body, we're also strengthening the brain because that's what's driving the whole system. But I'm also then wanting to strengthen the muscle specifically in terms of how it has to function. And every muscle has to function with other muscles. So it needs to be integrated in that way. So our pelvic floor in day-to-day life is not designed to just be a muscle that we manually contract. It's actually more often a unconscious process and response, and it's an anticipatory muscle that is responding based on how the other muscles around it are contracting and working. Because again, it's part of that shock absorbing system. So it's there being and adjusting and suspending and making sure that we're able to do whatever the thing is that we're doing.
Mm-hmm. This makes a lot of sense to me because my husband, Brett, has been doing Kegels. But I think what you're saying is like, there's more layers than just doing that one exercise. And at the same time that he's picked up this new routine, he changed his job so he has less stress in his life.
That usually helps a lot.
Working out more.
Yeah.
And focusing on it more. So I like the connection between how you're thinking about it and being intentional and the muscle movement, which, obviously relates to lots of activities in your life. The combination of all those things makes a lot more sense to me than just like, oh, I'm doing a bunch of Kegels now, so I have all this control and I feel great.
Totally. And the other piece I'm going to say too, we're also making a really big assumption when I say we, like society, or when the medical model is giving someone the recommendation of just do Kegels for a few months to address XYZ. We're making a really big assumption that that person actually knows how to do that well. And I'm going to tell you right now, no one is being taught how to do that when they're being prescribed that in our medical system. I have yet to have a patient come in and go, okay, so I was told to do these Kegels for a couple of months and it didn't work because this person's in my office. And also, if just doing Kegels for everything was the solution, then my profession wouldn't need to exist. Also, the prevalence of pelvic floor symptoms shouldn't have to be this big then if it was, again, that simplified. So Kegels have been kind of this like just bucket of this is what we tell anybody who has a pelvic floor symptom, good luck. And it is part of a larger system. We need to be looking at everything. When we can improve our movement, improve our hip range of motion, more strength around the pelvis, all of these things, the pelvic floor typically responds well because she's like, thanks everybody for finally showing up.
Yeah. Hallelujah in life.
Right? Like we need our squad. I'm often talking to my patients of like, all right, here's your pelvic floor. I know you're coming in because you think that she's the problem, but usually she's not. She's trying to do everybody else's job and she's freaking tired. Okay.
Mm-hmm.
We need to bring the squad back. Like, where's her squad? Where's her abdominal wall? Where's the diaphragm? Where are the other muscles around her? Because she's only as effective as the team that is supporting and working with her.
Mm-hmm. So she's like your point guard.
100%. Yeah. And then breathing is the other big piece that is part of this system. So back to that diaphragm. The diaphragm and the pelvic floor are designed to work as a piston system inside of the torso cavity. So when the diaphragm descends to allow our air to come in with an inhale, it lowers inside of the rib cage. That reflexively invites the pelvic floor to do the same. The opposite happens when we exhale. And this then coordinates what the abdominal wall and the spinal muscles are supposed to do because they're waiting for that response.
Mm-hmm. It's like a dance.
100%. So these are all of the pieces that need to be looked at, assessed, going, who's the bigger driver of interference here that needs help when I'm working with a patient? And I'm trying to clean that up as quickly as possible so then we can go, all right, what symptoms are left then? Because we can get a lot of symptoms that are happening in this way, but I go, that doesn't tell me what the primary driver is. So if I'm having pelvic floor symptoms and I'm just looking at the pelvic floor, I'm missing a huge piece of the puzzle.
Can we talk about the assessment for a minute and actually what therapy is? Because just full disclosure, I'm like scared to death about what this internal exam and all of that would be. And I have a lot of friends actually in town, like mama friends that have done it, and they sing from the rooftops like, this is the most amazing thing. It's so effective. It, changed my life. So I know it works. I just don't know what it is.
Yeah, great question. So as a pelvic floor physical therapist, I specialize in understanding the pelvic floor specifically, as well as the squat around her. In order to best assess the pelvic floor specifically, the internal pelvic floor exam is the gold standard. So what does that mean? Typically, I start with patients, and full disclosure, this is done with consent, of course. We are never forcing anybody to do an internal exam if they don't feel comfortable or don't want to on that day or any day in terms of treatment. So I want to put that out there. So if you decide that you want to see a pelvic floor PT, know that you get to be in charge of what assessments and things get done in a treatment and in a session. And if for some reason you have a pelvic floor PT who is not giving you that autonomy, get a new one, period, first and foremost. But I start with taking the pelvic model. I explain all the things to my patient before we even do the exam, because I want people to know, what are we talking about? What are you actually agreeing to consent to before we do the thing?
Mm-hmm.
Okay. An internal exam can include intravaginal as well as interrectal, depending on what's going on and what tissues and symptoms are happening. So with that being said, I'm looking at the external tissue, so the vulva, and doing some assessments there in terms of sensitivity, palpation. We can sense some muscle tightness, even just through the external skin. So I'm looking there for different things because sometimes we can have symptoms more externally as well as internally. There's a lot of shared nerve endings and other referral patterns that can happen with those muscles because they share a lot of the same kind of communication and pathway and nerves that also supply the external tissue. So we need to be looking at both. And then in the case of, let's say, childbirth and whatnot, if we had a pelvic floor tear, I'm also looking externally of like any scar tissue or different things that could be affecting the flexibility of these tissues. From there, I go and do an internal exam. And I'll preface too, my hand is gloved the entire time, just for everyone's knowledge. When I do the internal portion, I put some water-based lubrication on my index finger. Sometimes I'm using 2 fingers. It depends on what's going on. But yes, our best tool is literally our hand. I start at the vaginal opening. I gently insert basically to my first kind of knuckle. That gives me information of what is the sphincter doing and what is its tone or tension, or if we have sensitivity, its stretch reflex when I insert my finger. I'm looking at and assessing a number of things just on that first very small digit. Because the pelvic floor actually has 3 layers of depth. So we have the superficial, which is the sphincter level. We have the middle layer, and then there's the deeper layer. So I'm assessing each of those as I get slowly deeper. And our knuckles are actually a really good benchmark for what depth that is. As I get deeper inside and assuming that that's comfortable, accessible, tolerable, for some cases, that won't be. If we have so much tension or tightness or pain, I might not be able to fully assess those deeper layers until we do some other work to improve that flexibility so we can actually do an additional piece of that exam, because I'm never going to push through pain or tightness or tension against someone's body. That's not helpful. The point is not to also add further injury or trauma to someone's body to be able to have change.
Yeah.
So if we're able to do that full exam, then inside, I'm literally just like I would assess any other muscle in the body. I'm checking what's the flexibility. I'm palpating literally all the way kind of around the pelvic bowl at different points, at the top where it attaches at the pubic bone, out towards the side where it also shares some attachments to that hip. I'm also palpating kind of further back towards the tailbone, going like, what's the whole sling doing? Is there tension, tightness? Is it recreating some of my patient's symptoms as I get to certain points in that range? And then I'm doing that on the other side as well, because just looking at one side doesn't automatically give me information of what's going on the other side.
Mm-hmm.
Because the pelvic floor muscles literally span in multiple directions throughout the entire pelvic bowl. And then a big portion of this support is literally in the shape of a horseshoe. And that horseshoe is attaching at the pubic bone. It's creating a horseshoe all the way back to the tailbone and then sweeping back to the other side of the pubic bone. That horseshoe shape is what's primarily supporting the canals, the vaginal canal and the rectal canal.
Mm-hmm.
So that horseshoe shape, we can have sometimes tension on one side, tension more in the back, tension off to one full side compared to the other that I need to be looking and assessing at to figure out what's going on and what needs to be moving better so that we can have an even suspension system. Because if we have tightness on one side, the other side has to respond by lengthening. And then when we add load to that system, that suspension system is not going to be as efficient as it could be if everybody had an equal playing field.
This is fascinating.
Yeah, it is. So that's the assessment. So then once you figure out like what's tight, what's, if it's uneven,
Mm-hmm.
then you like part of your treatment could be like internal massaging or releasing of those muscles.
It can be sometimes. Yep. And also with this, I'm also doing a breathing assessment. So I'm asking my patients to breathe while I'm there. I'm literally just like sitting right in the middle of vaginal canal. And I'm like, okay, breathe for me. What's going on? I'm looking and trying to feel what's the coordination that's happening, or is it not happening?
Mm-hmm.
Mm-hmm.
I'm also looking at asking my patient to actually do a pelvic floor contraction, AKA, can you do a Kegel for me? And then can you let it go? And I intentionally tell my patients, I'm not going to give you any instructions because I want to see what your brain is connecting for that. And then I'm going to give you feedback if we have an opportunity to improve it. Most people don't know what a Kegel is, like we talked about. So they're often using a lot of other muscles instead of their pelvic floor. So clenching our butt, using our inner thighs, holding our breath, amongst a lot of other compensatory patterns that I will see in my office to try to contract or try to engage their pelvic floor when we're not actually getting that connection there. We're making up for it somewhere else. So I'm looking at a bunch of different things basically in this way. And then, assessing for, let's say, a prolapse or looking at those different things. Like I can feel and assess and notice where are certain organs, kind of where are they in that suspension system? If I ask somebody to do a pelvic floor contraction, is it actually connecting and lifting, or are they bearing down and actually pushing everything downward towards their feet instead of the lift upward towards their head? That's a communication issue in my mind where I'm like, oh, wait, we think we're lifting and contracting, but we're actually doing the opposite.
This is interesting for lots of reasons, but it's not surprising that mamas who have had babies have pain with sex after giving birth because they're basically getting a pelvic floor exam every time, without the benefits of the therapy.
Right?
Thank you, Pieve. Thank you for that visual, Pieve.
There's the visual.
Uh-huh.
I mean, yeah.
Jamie's son is 3. My son is 4. We both have suffered from lower back pain, like bouts of it sometimes that are debilitating where we can't move for a while. And I have gone to, we both have gone to just regular physical therapy that has helped probably with those other teammates that you were talking about, not necessarily the pelvic floor. So that's helped, but it hasn't really solved the problem. Like it's reoccurring. Yeah. So my question is, I guess, twofold. Like, do you have any tips for the back pain specifically? And is it ever too late for pelvic floor therapy after giving birth?
Great questions. I'm going to hit the second question first. It is never too late because it's never too late to get stronger.
True that.
And also the idea that the body is really resilient. It responds when it has better information, when we have better tools to know how to connect with our body, and adding more strength into our system at any age is always going to be helpful, first and foremost. Related to the back pain thing. So yes, going to more traditional like sports orthopedic PT is still a really good option. And if it doesn't fully address or solve the problem more permanently, then I'm always suspicious that there is probably a pelvic floor component that is involved in that puzzle. And our low back is often the teammate that starts to stand in for a lot of other players on that team when we don't have enough strength in that system, and or again, back to looking at the coordination of the breathing when we're loading. And did that get reintegrated after we, in this case, had a baby? Because that totally asks the system to change its patterns through pregnancy for obvious reasons. And the body doesn't just Control-Alt-Delete once the baby's out. We have to reintegrate these pieces. And unfortunately, our medical system has not yet placed that as the standard of postpartum care.
Postpartum care, what is that?
Thank you. Yeah. So low back pain is one of the biggest symptoms that most mothers have. And a big piece of this, I argue, is going back to not having been given good tools to know how to rehab your body after going through this huge change for 9 months. Also, not ever giving you a movement exam, but telling you you're all clear for exercise. And also 6 weeks is not enough time for the body to rebuild strength. Your wounds have closed or healed. They have not regained flexibility. They have not regained strength yet. And also we're assuming that whatever exercise that person might have been doing prior was helpful for their body, or that they already had a good base of movement. That's a big assumption then when we're telling people, just ease back into things, listen to your body. Also, what are you listening for? Did anybody tell you?
Absolutely not.
Yeah. So that's a big, long soapbox of mine in terms of this is also why low back pain, hip pain, pelvic floor symptoms are so prevalent postpartum and beyond into motherhood, because of where were you given good tools? Where were you helped to know how to retrain your body? I had to go to medical school for 3 full years and do pelvic floor as an additional specialty after PT school to be able to know how to answer those questions. Asking the general public to have to do that on their own is so negligent on so many levels. If you had an ankle sprain, you would go to PT. You would go to your ortho. They'd be like, oh, you sprained your ankle. You need to go to PT. You need to do multiple weeks of this to kind of rehab and strengthen all the things for your freaking ankle. But oh yeah, have a baby. We'll see you in 6 weeks. Okay, you're good. Bye. What?
Yeah, it's crazy. It's crazy.
Well, this is helpful anyway, because I'm talking about specifically to my back pain. I just associated it with not getting enough exercise. I'm thinking of walking and stretching, which I'm not saying doesn't play a part, but clearly I had no idea about this pelvic floor piece of my own grown woman body. And I attributed it to having got the baby weight that I'd gained. So I'm attributing my back pain to all of these other components, not realizing that there is this larger component of the pelvic floor that plays a huge part in my recovery. And let me ask this also while I have the mic, pun intended. Is any of this related also to the majority of the women that I've spoken with and to say that there is a lack of desire, a lack of intimacy, the desire for intimacy? I know there are a lot of things at play. You're trying to get used to your new body. You have this thing that's hanging on you, the kid. So in addition to those things, does the pelvic floor tie into maybe a lack of desire for intimacy?
This is a really great question, and one that I am often in conversation with my patients from a variety of different angles. There are a lot of reasons why our desire for intimacy is low in this chapter. A couple things. One, if we've had an injury to the pelvic floor and things don't feel good down there, it makes sense to me that people also don't want anything happening down there. So a lack of knowing how to address if we're having pain or discomfort. And pain and discomfort can come from, let's say we had a pelvic floor tear during the birthing process, and now we have scar tissue there that needs rehabilitation because that tissue is not gliding well. That's not going to make intimacy comfortable. We need that pelvic floor to be able to be flexible. Otherwise, if we're having any type of touch externally or having anything internal, that's going to create tug and pull that doesn't feel good. Likewise, if we've had a C-section incision, we can have some scar tissue up there that is actually adhering the other structures underneath, i.e. the uterus sometimes. Now, those two things are adhered together. That uterus is attached to your vaginal canal. If we are now inserting anything or asking those things to stretch, they're all connected. That can make things not feel so great either. Also, we have hormonal changes that are going on. In those early postpartum weeks to months, and especially if we are nursing, we are in a lower estrogen state, and one of estrogen's many jobs is to be part of the lubrication system for our vaginal tissues, and also is a really important driver of the circulatory response to those tissues. So if we don't have good circulation or hydration to those tissues, they're not going to feel super great when we're asking them to now glide against other tissues. This is why vaginal dryness is such a common complaint during this time. And everyone's nursing journey can be a very different length of time. And so I share all this not to be like, if you're nursing, that's just as good as it gets until you end. Not at all. But rather to say this is a component that is going on internally. And this is also why libido is often part of the reason it is lower, because when we have that lower estrogen state, we don't have the usual kind of feedback loop that helps us to want to have different times of the week where we're like, yep, definitely interested in that. Because evolutionarily speaking, we're trying to prioritize taking care of this new life here.
Mm-hmm.
We're also mature mothers in our early 40s. And I feel like a lot of what you just described about postpartum, we have this other layer of just, I hate to say it, midlife changes. It's like, I can't even get those words out of my mouth. It's so hard to say. So yeah, I feel like there's just like shit coming at us from every angle in this sense. And we're just like, pipe down, like just give us a break.
It's a lot.
Yeah.
It's a lot. But yes, these hormonal changes are absolutely part of the, conversation that need to be supported. There are different ways to address these pieces too. So there's medication in the sense of topical estrogen or intravaginal suppositories with estrogen that help to create and drive estrogen locally to those intravaginal tissues that help a lot. This can be done as a very short term kind of like temporary time, or as something later into our later decades as women, where having that additional support is a really big piece that can address this problem. Also, as we get into our later, decades, this is where different hormone replacement therapy for us to support these changes, as well as the tissues down there, because estrogen is not just important to the vaginal tissues. For us as humans, it's an integral piece of what helps us to maintain our bone mineral density for our bones. It's also part of our circulatory system as well. And also it's part of what helps us to be able to achieve a full muscular contraction of our muscles to produce force. So it's not just a hormone for down there. It's like for the whole body. So us as women, we get impacted differently in this across our lifespan in terms of how those hormones have to change. And so hormone replacement therapy as a tool in the toolbox with your provider to talk through these things is a really important piece, not just when you get there, but like trying to support it through these different chapters leading up to it. In addition to strength training. Strength training is a huge help and contributor to these things, because it is also another way to help improve muscle strength, bone mineral density. Because when we have better muscle strength and more force production on the regular basis, that provides healthy stress to the bones to keep them laying down calcium to maintain our bones. Plus, we need strength during motherhood and throughout our longevity to be able to do life. When we lose strength, we lose independence. And I feel like we as women are constantly bombarded by do more cardio and not encouraged enough to lift weights. We need both, but especially for motherhood. Motherhood is an athletic event every freaking day.
Preach it.
Yeah. Okay. So we need strength training. We need the cardio. We need both. But there's, like I said, there's this overemphasis on cardio and an underemphasis on strength. And the sooner we can start to incorporate more strength training, that actually helps with a lot of these other hormonal challenges as we get into our later decades. So it's a both, but just wanting to hit that there.
Can I ask a follow-up question? Because all of this is so enlightening. It's like putting pieces of the puzzle together. A little bit ago, you were talking about injury to the vaginal wall or your pelvic floor muscles or tears. So I feel very, very fortunate. I had a vaginal birth and I didn't have any external tearing because my OB was so amazing.
And you were also amazing. So yeah.
That's right.
You. Yeah. Thank you.
You're all amazing regardless of what happened in your birth. I just want to point that out. Clarification. Yes.
Absolutely.
It is a team effort. Once again.
Yes, it really is. I very intentionally made, my support system through the childbirth process so that that was an option for me. But what my question is, just because I didn't have any internal stuff wasn't going on, right? And another thing that you were talking about with circulation, it just has me thinking with the intimacy piece, Are there like sensitivity things that can like consequences of having like internal injury or tears to the pelvic floor and the muscles all up in there?
Good question, Pete.
Yeah. So 2 pieces. One, even if we didn't have a tear, which is great, those muscles still can sustain other injuries, like a stretch injury or a nerve injury or other things like as baby is coming through. Okay. And also, we can have a pelvic floor, with no tearing in a birth that doesn't have any of that, but it still had to stretch like 10x, literally. Like that's not an exaggeration, like 10 centimeters. It doesn't do that under non-birthing situations. Any tissue that is asked to significantly lengthen like that also needs time and rehabilitation to regain its original capacity and to rebuild strength into that. So we can still have pelvic floor challenges even if we didn't have any tearing. That can show up sooner, that can show up later.
Interesting.
The other piece that you mentioned, yes, if we actually know that we had a tear to the pelvic floor, and the vast majority of women in the US, the statistics show that out of individuals that birth vaginally, about half of them will sustain a grade 2 tear. That means we have a significant muscle injury to the pelvic floor. For context, in a sports situation, if you had a grade 2 muscle tear to your quad or your bicep, it would be immobilized in a brace.
Wow.
Do they make vagina braces? Just wondering.
I was going to say, do they make braces for your Susies?
Right?
So send me one to Florida, please. I know she's broken. Poor thing.
She's not broken.
She's just sleeping. Okay, we'll wake her
She's
back
on the
up.
injury list.
She went through a lot. Yeah, she needs her rehab squad. Okay.
That's right. She needs her people.
Yeah. So just for context, like, that quad injury or that bicep injury, like you would get an automatic referral to PT. We would have to go through range of motion things. We would have to rebuild strength gradually and then do a return to activity scaling. Okay. Your pelvic floor deserves the same darn thing, but she's not treated that way because birth is just natural. A grade 2 tear is significant. It's going to need time to heal. And to your point, the pelvic floor is not an area of the body that we can offload. You still need to go to the bathroom. You still need to move. We cannot immobilize her. So often those muscles, continue to have pain, discomfort, a lack of flexibility because they didn't get good information to know how to rehab that area. And this can cause pain, discomfort, add to incontinence, AKA that's the fancy word for leaking, right? This can be urinary. This can also be fecal sometimes. So there's a lot of other pieces that can happen here when, again, that muscular sling is not able to suspend well and be flexible well through the whole system. If there's a kink in that suspension system, it's eventually going to create challenges. Now, the good news is that can be improved. We can regain that flexibility with scar tissue massage and education and like helping to help those tissues find that range of motion again and then build strength into that. But again, that's being left on the general public to figure out on their own. Insert why society hears this message that it must be normal, right? Then cost of admission into motherhood, to have pelvic pain with intimacy, to leak. Yeah. Every time I pee, sneeze, or even think about a trampoline, right? Like these are jokes, but they are also a product of us confusing common with normal.
Yeah.
And a lack of good resources for you all from the beginning. It also doesn't help that you walk into a CVS and you see the entire incontinence aisle. Okay. So it's really confusing.
Dr. Chris, you've dropped, I don't even know how many nuggets of knowledge. I'm trying to pick them all up. So we'll get some Cliff's notes for everybody. I'm sure everybody is feeling equally as inspired and also like trying to grab them. if you had to highlight maybe one or two main takeaways for our listeners, you said, if you don't leave with anything else today, I want you to leave with this. What would those maybe one or two nuggets be today?
It is never too late to get stronger.
I love that.
And it's never too late to go to Pelvic Floor PT and invite one of us on your team to help you.
Maybe 3 nuggets. I lied. Those were 2, but maybe one more. There's so many.
And my other one is that, like I just said, leaking, pelvic pain, any of those symptoms in this part of our body, they do not have to be your cost of admission into motherhood. Hit unsubscribe to that.
Mm-hmm.
You deserve to be able to move in all the ways that you want to still maintain your athletic ability and identity, because mom life is an endurance sport. Okay.
Oh yeah.
And also you're allowed to still have a great sex life even after having kids.
We're trying to get on that train.
Yeah. And I think also just normalizing that, like, were we even given good tools before we had the babies about this? I would argue no.
Not even athletes. I mean, we had like trainers, whole training teams. No one ever even mentioned the phrase pelvic floor.
No, I was told I had bursitis in my hips. PB knows this. At my 19, my sophomore year, all of a sudden I had bursitis. So now I'm thinking, was it bursitis or was it just a larger symptom of something else?
Mm-hmm.
It was that latter one.
Mm-hmm.
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 Absolutely.
I know we're going to let you go soon, but I have one last like $1 million question, because I feel like you pointed almost in every single answer to one of the reasons why women are sort of have this plight is because we have really poor maternal health care, access to resources, information, all of the above. I don't know is a totally fine answer to this question, but do you think there is or are solutions to the problem, like this healthcare problem for women? I mean, and men have pelvic floors too. So maybe this is just a society question. Like are there, not that you personally need to solve this, but like if you could wave a magic wand and say, this could be our reality.
Honestly, if I had a magic wand, it would be that everyone was able to connect with a pelvic floor PT on a prevention basis. Like your annual exam should involve also an annual exam with a PT to assess your movement. Hey, what's going on here? What needs to be better, moving here to mitigate things earlier on rather than when the entire system hits a breaking point. I also hate that the annual physical is even called a physical. There is nothing physical about it.
True.
Very true.
I think that everybody annually should be able and should be included in our insurance of, like, if we're continuing to move well, then a lot of these things don't have to be bigger issues. So having a PT on your team, I'm obviously biased, get one that is a sport, ortho, and pelvic health, because then you get all of it. Okay.
Preach it.
Because your pelvic floor is also involved in sports and orthopedics, even though our medical system doesn't look at it that way. I look at it that way. But whether male or female pelvic floor, your core team works the same way. And if that core unit is moving well, then the rest of the system has a much better capacity to move well for longer. That would be where I would wave my magic wand and be like, this should just be part of our learning about our body, learning how to squat, deadlift, move things, learn how our body works so that we can appreciate it better, rather than it being like, oh gosh, I only can seek out help when stuff's going wrong. And now I have to be in pain to learn. And emotionally, I'm in pain because I don't know about my body. And this inserts so much shame and discomfort and expense to have to improve our system that it creates, I think, more dissociation of wanting to improve that area or learn about it rather than inviting people to want to learn. So when I'm with my patients, I'm like, this is an opportunity. I know you're here because you have pain. And also I'm going to show up on your team to be a steward to teach you about your body. Because when we know more about it, we can't not want to appreciate it more and realize how it folds into all of these other pieces. And what I also love is usually when I'm with my patients, my practice is all women. Most of you are moms also because of what I do. And the beauty that often the nuggets and things in my office that come out of these conversations is like, I want to model that for my kids. I want to teach them about their body. I
Yeah.
want them to see me move. I want them to move with me. I want to incorporate this as part of our family kind of unit and like what we do. That's
Yeah.
how we also improve generations of like learning about our body, understanding about our pelvic floor, and where it doesn't have to be this like secret thing.
Mm-hmm.
We need to be talking about it. We need to learn about this part of our body. We want to know what things are happening down there so we can be better stewards of like, oh, my body needs help here, or oh, yep, everything's going okay.
Mm-hmm.
And starting earlier in our lifespan so that we're not learning about it when, all of us are like in our 30s and 40s. That's a lot of years that we deserve to know about our body way earlier.
Absolutely.
I think there are cultural things at play also, right? Because if we take that
Huge.
component and there's certain cultural norms where you're conditioned to believe that it is taboo to talk about your body, specifically that part of your body. So I think that a lot of this also is rewriting narratives around the beauty and the benefits of understanding and knowing our bodies. And I think that there's some space there to do
Right.
work, massaging through those cultural norms where this may be seen as taboo to even have this conversation. So Thank you for all of this. I don't know how much room you have in your house, Dr. Chris, PV. I don't know how much room you have in your house, but if you have room for 3, my husband, son, and I will just move to Santa Barbara and
perfect. We'll figure it out.
Do this all day. Okay, cool. I appreciate it. Thank you.
Yeah. No, this has been so, so awesome. We really, really appreciate your time today and for dropping all this knowledge. And you are in Santa Barbara, so I am lucky. I am one of the lucky ones, but it doesn't mean like Jamie from Florida or wherever other people can't find you and your resources. So can you tell all the listeners like where they could find you, and maybe you have other like more general resources that you point people to that would be educational for folks too.
I am in Santa Barbara, California. So technically, due to medical licensure and all of those rules, if you are a resident of the state of California, you can seek out pelvic floor PT from me in person or virtually or any other therapist you need to be in your state. Is kind of how all of the legalities of that work. But also recognizing kind of the conversation we're having, like not everyone has access to a pelvic floor PT. There are not enough of us for how many people would benefit from our services. So sometimes people don't have a radius of clinicians near them to be able to seek out care in person, but you can still kind of, sometimes virtually be able to connect to get some information, different things like that to support your care. There's a website called pelvicguru.com, and that has like a directory. It's not all inclusive, but there's a large majority of us clinicians that are listed in that directory, and you can search by zip code. So that's a helpful way to kind of like get a little bit of information of who's within a reasonable radius of you if you want to connect with a pelvic floor PT. The other angle that I often will encourage people who are outside of my area to be able to directly connect them, like if you don't know how to find one, or if that search on Pelvic Guru is not popping up people that you can access easily, I often go, who else, what other clinicians or providers would know about someone like me? Big ones that I always throw out are like other midwives in your area, other like doulas, lactation consultants, like other birthing providers typically know who we are in their communities. So you can always Google some of those, call them and ask, be like, hey, I'm looking for a pelvic floor PT. Who do you guys recommend? Also, they usually know in the community, like who are the really strong ones and whatnot, because we often collaborate. So that's also another good way to kind of like vet people if you're, curious or wanting to find someone near you. In terms of my personal resources and kind of, again, back to our conversation, like there's a lack of being able to access a lot of this information. And so a big piece of my personal mission is trying to always contribute into the community, provide a lot of free information so that people can have a better baseline of information to then be able to make their next best healthcare decision. So for me, I have, my YouTube channel. On my website, we have a number of free resources as well, my clinic website. And I'm also about halfway through making a online self-paced postpartum course that's going to be helping people to understand how to return to exercise. Like, how do we actually break this down postpartum? But it can really be for anyone at any stage. If you have had a baby and you're still feeling like, I don't feel as connected as I wish that I did in this part of my body, and wanting to feel like you have a roadmap to follow, this course is for you. And in there, I've also included not just movement workouts, but also pelvic health education videos. So talking about a lot of the things that we even mentioned today here, helping to explain pelvic floor anatomy, talking about what is your core. If we had a pelvic floor tear, like how do we do pelvic floor perineal massage to improve that flexibility and that scar? How do we do that for a C-section? What are some of the common diagnoses that often bring people into my office? What is it? What does it mean? What do we need to keep in mind? How do we address these things? Spoiler, how do we address it is we get stronger, and then if this course is not fully helping you to resolve the things that you're experiencing in your body, this isn't the end of the road. You would then benefit from connecting one-on-one with a pelvic floor PT. Because while I wish and would recommend that everybody access one of us to help them, I also realize that that's not a reality, both from a time standpoint, financial standpoint, scheduling, but also location, amongst a lot of other things. Mm-hmm. So wanting to try to also be a steward and understanding that this is a big issue. And part of me being in this area going, all right, I have my clinic, but I can't see everybody in person. I can't see all of the people, even if I could, time-wise, and going, how do we create better resources so that people can get better information earlier on? So these are a few things that are in the works from my side. So all of that can be found on my website as well. And then next will be a whole prenatal program that I'll build out next, but trying to kind of create some other avenues for people to learn.
Very cool. Did you say your website? Can you say your website again?
Yeah, it's Pieton PT. So my last name, Pieton PT.com.
Perfect.
Awesome. Thank you so much.
You're so welcome. Thank you again for having me, for inviting me on, for giving space to talk about something that always needs and deserves more airtime, but doesn't always get it. So thank you all for also helping to be a piece of improving access to this information, because it's a team effort.
Yeah, absolutely. I mean, we didn't even know we needed to know half that stuff.
No. I hope there's not a pop quiz. If there's a pop quiz, I may fail, but I'll come back after the show notes. So this was beautiful. Thank you, Dr. Chris.
Thank you so much. Thank you so much for listening and being part of our conversation and our inner circle.
Follow us on Instagram, _It's a Mother Podcast. And we look forward to you and your best friends joining us next episode.
Leave a rating on this podcast app. It really helps us get our conversations to more friends out there, more friendship circles, and more women and more mothers. And that's what we're here for, to broaden the conversation, to bring everybody into the circle.
Thank you for listening. Thank you for joining us. We'll talk to you soon.
Go call your best friend.